Hello, everyone. My name is Aisling Hennessy, and I work at Global Heart Hub as our Patient Community Engagement Associate. I'm delighted to welcome everyone to our Empower webinar today. As many of you know, Global Heart Hub is an alliance of heart patient organisations and patient advocates working to create a unified global voice for those living with or affected by heart disease. Today, Global Heart Hub has partnered with Cree Heart and Stroke Charity and their patient network Heart and Stroke Voice Ireland to deliver this webinar. We're focusing today on the social and emotional challenges that often accompany a heart or stroke event or diagnosis. We will also focus on some of the tips and strategies that you can use to support your emotional and social well-being. Just a very quick housekeeping note before we begin. Automated translated captions are available in over 35 languages by clicking the caption button along the bottom of your screen. And today's webinar is also being recorded for those who couldn't attend today. With that, I'm excited to introduce you to all of our panelists who you can see on screen. We are joined by Lisa Hines from Cree, who will give us a foundational understanding on the topic, and she'll also discuss the role patient organisations can play to support your social and emotional recovery. We will hear from Bia Gomez from Cree, who will discuss some stroke-specific challenges and strategies she recommends guiding you through your recovery. Peter Fallon is a patient advocate and stroke survivor who will discuss some of the challenges he has faced following his stroke and how he has adapted to his new normal. And Kulvinder Kent Gill is a patient advocate who will discuss her experiences with cardiovascular disease and how she has utilised various techniques and activities to focus on her well-being. And without any further delay, I now hand over to Dr. Lisa Hines, who will set the scene for us.
Hi, everyone. Thank you so much, Aisling. So delighted to be here. Happy to be speaking on this topic of going beyond the physical. I'm a health psychologist, so this is absolutely what I'm passionate about. So I'd like to start by inviting you all to reflect on what emotional and social well-being means to you. And I think really what we're getting at here is an appreciation of the fact that health is so much more than the physical. When we think of health, we probably think of the physical straight away. But as you can see here with this wellness wheel, and there's loads of versions of this, there's loads of ways that we understand and look at wellness, that there are so many components, including the physical, but also the emotional, the spiritual, the financial, the environmental. It's really about all of the ways that we live our lives and our ability to do the things that we want to do. So some of the things that might have come to mind when thinking about emotional and social well-being could have been things like having a sense of purpose, social connections and places to go, looking after ourselves, the idea of mental fitness and resilience, something that is as important as our physical health, looking out for other people, social connections, finding time for ourselves, which can sometimes be challenging. Something that can be up and down. Our emotional and social well-being isn't something that's always the same, and having support when we need it. So it really is a multi-component thing. It's really interesting though how even though I think we now have a really good understanding of the mind-body connection, the fact that our health is this multi-component thing, that it hasn't always been like that. And interestingly, that disconnect between the head and the heart, the mental and the physical, the spiritual and the physical, is sometimes dated back to the time of the Spanish Inquisition, when Descartes kind of convinced the church that the body was the realm of medicine and science, and the head, I suppose, and the mental, the spiritual was realm of the church, so that they could proceed with their scientific work. And apparently the story goes that Descartes' head and body are buried in separate places. So he really has a legacy, I suppose, of starting off a disconnection between the head and the heart. We did lose the idea along the way that the head and the heart are all part of the one system. But I think importantly, we are getting back to that understanding. The head and the heart are part of the one system, and that is such an important understanding as part of our health. So when you see the definition from the WHO of health, you really see that coming through. So health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So straight away, when we're talking about health, we are talking about more than physical. And importantly, when we bring the definition of mental health into play, sorry, I'm having a little freezing here. One moment. Sorry about that. When we look then to the definition of mental health from the WHO, again, we're seeing something that's really multi-component. Mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. You know, when we use the phrase mental health, we often think of something other, something that doesn't relate to us, something kind of very serious. But actually what we're talking about, as you can see in the definition here, is about all of the ways in which we live our lives, the things that we do in our lives that are important to us, that make our lives rich. But I think pretty quickly, people who have experienced heart problems or been affected by a stroke can see that some of those aspects of health and mental health are very clearly impacted. So, for example, experiencing a heart event or a stroke is not a normal stressor. It's something that's often traumatic, unexpected, and can really have an impact on every aspect of someone's life, including their ability to do the things that they want to do, their ability to learn well and to work well and to contribute to their community in the way that they did. So it really emphasizes to us how important it is to take account of our mental health, our emotional and social well-being when it comes to living well with a heart condition or after a stroke. Because a heart event or a stroke is an unexpected, a serious event, all feelings are normal. Everyone will have a different reaction after a heart problem or after experiencing a stroke, and different experiences. A health event, any health event, including a heart problem or a stroke, can change a person's view of themselves and their lives. Importantly, recovery will take time, but with time and support, you can feel better and get back to life. So although mental health, emotional and social well-being is very much impacted by a heart condition or a stroke, with time and support, you can feel better and get back to life. Some of the emotions that are very commonly experienced are really nicely summarised here on this slide from the National Heart Foundation of Australia. So things that people describe an awful lot are things like shock, anger, sadness, as you can see here, for lots of really understandable reasons. It's really important to kind of put this out here to normalise the fact that many different strong emotions can be experienced. Because as a result of the fact that we don't always think about our emotional and social well-being when we're thinking about our physical health, it can really be a real shock and a real extra difficulty for people who are experiencing a heart problem or have had a stroke, when they do find themselves, feeling emotions such as these. So really important for us to put that out there. And there's a lot of really good reasons why people are experiencing different stressors, different worries in this context. So, for example, worrying about your health or having another event, the changes that people go through to their daily routine or their lifestyle, concerns about things like work, money, or family, feeling unsure about the future, dealing with medication and medical appointments, feeling tired, down, or worried. But by becoming aware of feelings of stress and the things that can cause stress for you in the context of a heart or event or a stroke, you can start to manage stress differently. A really important thing to say is that all of this is really normal and to be expected. And the majority of people affected by a heart event or a stroke will experience distress of some level at some point. For very many people, it can very much be managed, and in some cases, it will become something like a diagnosis of anxiety or depression, which can also be managed with potentially extra support. But really important to acknowledge that stress is a normal part of life, and these kinds of worries are a normal part of recovery. We don't want to look at these worries or stresses as always a disorder, as something to get to be gotten rid of. It is a normal part of life that will most likely improve with a bit of time. But one thing to think about is if emotions or worries are really getting in your way, they're stopping you from doing the things that you want to do, that's when you know it might be time to talk. It might be time to look at additional supports. Really importantly, looking at our social emotional well-being after a heart problem or a stroke plays a huge role in recovery itself. So we know that stress, emotional and social problems can affect our health in two ways: through what's called a direct pathway in terms of the effect of stress on the body through things like inflammation, and through a more indirect pathway, and that's through more lifestyle factors. So we all know that when there's a lot of worries, a lot of stresses going on, it's much harder to prioritize things like exercise or healthy eating, things that play a huge role in recovery from a heart problem or a stroke. So these are the things that you will all be very familiar with around taking care of your general health as part of recovering after a heart problem or a stroke. Things like eating healthily, getting regular exercise, getting enough sleep, cutting down on alcohol, quitting smoking if you smoke, going to your doctor and nurse regularly, and noticing your quick fixes, the things that you might do to help comfort yourself at different times of high levels of stress. And it's really important to have things to reach for to comfort yourself, but noticing if maybe those quick fixes are things like not engaging in exercise, they're not spending time with friends, which can really get in the way of your ability to take care of your health in a general way. So these kinds of general self-care approaches, and also things that are so important in recovery, help to support positive mood, help to reduce stress in and of themselves, and help to feel more in control, which is so important when a lot of things can feel out of control. I just want to touch on a worry that comes up very regularly, which is around having another event. So we're all aware of those important signs and symptoms of a heart attack or a stroke. So being aware of these things plays a huge role. This is already about focusing on controlling the controllables. It's really understandable, very common that people can worry about having another event or a stroke. So something that you can do that might help is to take all opportunities to get information for yourself, to get your questions answered by talking to doctors and nurses about any different questions or worries that you might have as you move through your recovery. Let your family and friends around you know how you're feeling, and follow the guidance that you receive from the hospital. Those things like, taking your medications or being physically active are all things that we know help to reduce our risk, as well, of course, as taking actions on signs and symptoms at any time that you have any worries or you're wondering about anything. I'd like to really highlight to anyone interested in this area that the European Society of Cardiology have recently published a consensus statement on mental health and cardiovascular disease designed by and for patients. So I really recommend you having a look at that. It's an excellent document. But I just want to finish off by saying that it can be a really, really good idea to engage with patient organisations in your area, locally or nationally, to get access to different services that might be on offer. You can see the services that are available here in Cree, things like exercise classes and support groups, to, I suppose, be able to benefit from things like supports for self-management, having different activities to engage in, and places to get answers to your questions, as well as opportunities for sharing stories. And that's something that people do within CRE through our patient network, Heart and Stroke Voice Ireland. There are many ways that we can support our social and emotional well-being, and the 5 ways to well-being can really be applied as you engage in a recovery at whatever stage you might be at, by sharing your experience, by learning about your recovery, by connecting with others, whether it's through a patient organization or other people in your life, by taking all opportunities to notice what's going on around you, to be mindful of what's going on in the present moment, even if there can be a lot of worries and stresses, and by taking all opportunities to move, because all movement counts. So although there can be many things to be taking care of when it comes to your physical health and your emotional and social health, I just want to finish off by emphasizing how important it is to be patient with yourself and to be aware of how you're doing in all of the ways that make up our well-being and the support that you might need along the way. So I'm going to pass over to Ashley now to introduce my colleague Beatrice.
A huge thank you, Lisa, for those incredible insights and for really setting the scene there. You've given us a really great understanding of why it's so important that we talk about this today. And with that, I'm really happy to hand over to Lisa's colleague, Bea, who will offer some stroke-specific insights on social and emotional well-being.
Hello everyone, thanks Lisa, that was brilliant, and thanks Ashley for the introduction. What I'm gonna do now is I'm gonna discuss a little bit more in depth the stroke specific impact on social and emotional well-being, how these challenges are often invisible, and also the importance of social and emotional support and well-being strategies as part of the recovery journey after a stroke or after a heart disease. So firstly, when we talk about emotions after a stroke, it's very important to remember that the stroke is a sudden and shocking health event which affects primarily to the brain. 1 in 3 stroke survivors experience emotional distress, and the risk is even higher for those whose stroke has affected the right side of the brain or the frontal lobe strokes. These emotional changes that often people have to face after their stroke, they are not just in their head, and they actually have a real physiological basis. As I say before, a stroke is primarily affecting the brain, and the brain is like the control center for our body. It regulates the way that we move, think, communicate, but it also regulates the way that we feel and behave. So even a mild stroke can shake your confidence or make you feel like you are not quite the same person after the event. So obviously all of that will have a huge impact in the daily life of the person, and it will affect their independence, routine, roles at home, at work, and how they see themselves. All of these are very human response to a major life event, and they deserve just as much attention as the physical side of recovery post-stroke. And would you mind, Joanne, moving to the next slide? Thank you. So when we think about the stroke recovery, it's really easy for us as healthcare professional just to focus in the recovery of what can be measured. And I'm going to be honest with all of you, it's just much easier to focus and measure things like balance, gait, muscle strength, memory, you name it, we are going to have a scale to measure it. But what happens when we want to measure emotions, mood, and social well-being is just that things get a little bit more complicated, because there are multifactorial factors that will influence in the emotional emotional recovery of the person post-stroke. So things like, do this person have a strong family support or social network around them to support their recovery? Is there someone who really listens to what they have to say? Can they afford to take time off after the stroke, or is the financial stress adding extra pressure to the stroke recovery? Do this person live in a city and have good access to public transport, or are they living in a rural area with no access to bus or trained and they can't drive anymore because the driver license has been removed after the stroke. All these factors are very important to take in mind, and they will shape recovery after a stroke as much as the physical limitation that can affect the person after their stroke. Can we go to the next one? Thank you. Social and emotional support are play a central role in stroke recovery, and in fact, all these examples that I just mentioned can influence progress just as much as the size or location of the stroke. And they are often harder to address because their effects are largely invisible. So, yet from the outside, the person may look fine. This invisibility can lead to social withdrawal, avoidance of unpredictable situation, feeling embarrassment when emotions become difficult to manage. So, for us as a healthcare professional, it's very important to acknowledge that this hidden impact is real, valid, and is also part of recovery, and is actually, in fact, a key step in helping people feel genuinely understood and supported, and which it will help them to feel less insulated after the stroke as well. So, when people actually feel understood, connected, confidence grow, and they begin to reconnect with their identity, rebuild meaningful routines, and rediscover joy and participation in everyday life. Thank you. And here now I'm just gonna talk about a few examples of how CRI build social connections into how we try to build social connection into everything that we do. Here on the left, you can see an example of some of the life after stroke programs that we have here. All of them include a 30-minute social break. And this break is not only to physically recover after the exercise or after the program, they are thought to be used to chat, to connect, to share a cup of tea, a coffee with others, and to build meaningful social moments, which are an essential part to support emotional recovery after the stroke. Other example of well-being activities that we have here at CRI, and that they try to go beyond the traditional rehabilitation will be our exercise classes. We have yoga, tai chi, pilates. We have plenty of other activities that try to focus in well-being, like art session, movement and mindfulness classes. We also have educational workshop here at CRI. The most recent that we had was our intimacy and relationship after a stroke workshop. Of course, we can forget about our monthly stroke support group meeting. At the moment, we have 4 support group meetings here at CRI. One for stroke survivors and family members. This support group meeting is happening in 2 different locations here in the west of the country. We also have a monthly support group meeting for CAREST, and we have our All Talk group, which is a support group meeting for people who are living with communication issues. And this last group is led by a volunteer speech and language therapist that is working with us. We also have here at CRI our CRI telephone helpline, where people is welcome to call and talk with our cardiovascular nurse, who she will be very kindly answer any type of question or concern that people may have about their health, change of medication, side effects. And we also have our weekly online chats when we cover different health topics that can be relevant for people that have had a stroke or other type of cardiovascular event. So the way in which all these services and programs can complement healthcare system is by trying to provide a continuity of care for the people that have been already discharged from the hospital. They are back, back at home, living in the community, and they are trying to rebuild their social network after the event, stroke or cardiovascular disease. So this type of programs, activities, they reduce insulation and they can improve adherence to the lifestyle change modification that has been recommended by the clinicians or doctors. The feedback that we have got from many of our participants here at CRI is that having this safe space to come in and talk with others who truly get what they are going through has given them a new motivation, a sense of connection, and has renewed their purpose of living their life after a stroke. It's a very encouraging feedback for us as a healthcare professional to keep working and doing what we do. Regarding some tools and strategies to improve social well-being that we can all follow at an individual level by establishing simple routines to follow every day, pacing and following energy management strategies to reduce overload and spread energy through the day or through the week. It can be very helpful as well, using meaningful activities to reveal identity. They can be art focus, exercise classes. There is plenty of things that we can all do to reveal that confidence in ourselves. Following communication strategies for those who are living with communication issues, aphasia, dysphasia, and also one of the most important actually will be celebrating all our small goals and little wins and sharing it with family members, friends, with the staff, the specialists who are following your recovery. I'm sure they will celebrate it with you as well. And other things that we can do as well is to join and link with other patient organizations like CRI or Global Heart Hub, and join our community groups to peer connection, to meet others who are going through very similar situation and will understand this particular and individual struggles that you have to face after a health event. As Lisa mentioned before as well, accessing to libraries, resources, understanding better what we are going through, it will also help and facilitate the well-being recovery after a stroke or a heart disease. And yeah, so you know, here you all have our QR, you can scan it and you can access to our newsletter and you can read more about what we do here in Galway in the community.
Amazing. Thank you so much, Bia. That was a really excellent presentation. You've given us some crucial insights into challenges beyond the physical, particularly for those who are stroke survivors. And these challenges can often be more invisible or definitely less spoken about than the physical challenges. Now, we're going to break into a discussion with patient advocate Kulvinder Kent Gill. Unfortunately, Peter has been unable to attend today. I know he'll be disappointed, but I have no doubt that Kulvinder has some really wonderful insights for us. So Kulvinder, would you mind introducing yourself, giving a bit of background, a little snippet of your story before we open it up to some discussion?
Hello everyone, and welcome to the Global Heart Hub Empower webinar. I'm very grateful to be here today and to talk about my experience as a heart failure patient. A little bit about me. I am from the United Kingdom. I live in London, and my health journey started back in 2018, but unfortunately it escalated in the summer of 2022. I suffered a cardiac arrest and was put on ECMO. ECMO is a life support machine that temporarily takes over the function of a patient's heart or lungs, and it was both in my case. When I awoke from ECMO, I couldn't speak or move. I was completely immobile, and I had lost all strength and muscle for a short time that I was in ECMO. And truly, that is where my journey actually began. I needed 24-hour care. I was unable to do anything for myself, and I was in a wheelchair. In the early days, this was very frustrating for me, not being able to do the things I once could do for myself, things that I took for granted. And those were very, very difficult times. But now it's 3 years on. I have learned over trial and error how to devise routines. I've started to add goals. And, those goals have not worked first time always, and they've taken me back to square one. But what I found is that it's not to go full Tony Robbins, for example, is to take slow steps and learn from those setbacks. And in all, I've had to learn to be very, very patient. One of the things I've started to do is to learn yoga. And this discipline has allowed me to reconnect with my body, and it's actually allowed me to experience its new limitations. It makes me feel like a child learning its first steps, for example. My sense or understanding of my mobility that once was is in my head, but then actually using my body to do the yoga is a totally new experience. And I think for me, that's part of the healing journey. Is mentally we can understand all of these variables, but it's only through the body that you do start the initial steps towards healing. Today, in terms of my health, I continue to learn yoga. I'm currently looking into the somatic approach to the body in terms of managing stress and anxiety, and I'm not very good at that, and I don't expect myself to be. It is a journey. I've enrolled on a counseling course, and this has helped me to understand my own situation and issues around mental health. And I think that's very important, because we have all of these feelings and very strong emotions, but unless we understand the theory of where they may be coming from, I think you get stuck. And I think being stuck is where the stress is, and then the stress compounds, and then there you are back at square one again. So as a quick overview, for me, self-reflection has been the foundation. With this chronic illness and with these various journeys that I've taken, I've had a loss of identity. It's part of the chronic illness journey, and reconnecting with myself has helped me. It's taken me on a journey to learn about my illness and find ways that I can supplement my healing. And it's still early days, and I'm still learning, and it's been positive. It has allowed me to find a purpose in my life. There was a moment where I couldn't see a possibility of that at all. I had lost my career. I worked in finance, and it wasn't a very nice time. But now, I do feel that I am on a new path, and I'm excited about that. And it's both daunting and fulfilling at the same time, if it's possible to have those things at the same time. But that's where I am, and it's nice to be here and to share that journey with everyone here today.
Yeah, well, thank you so much for sharing that, Kulvinder. I imagine it certainly hasn't been an easy journey, but you should be so proud of yourself, because it's hard to believe that looking back to 2022 where you were, and now you're using that hardship on a webinar to help, many other people. So you should be very proud of yourself. Looking back in 2022, when you kind of woke up, I imagine it was very quickly apparent that there was going to be a huge physical recovery ahead of you. Do you wish someone had kind of warned you about the social and emotional aspects, perhaps more than the health system currently does? And do you wish there had been immediate resources on those aspects of your recovery from the get-go?
Um, yes and no. I think with these experiences, you can never fully plan for them. With my healthcare team, they did provide certain things for me, but I think they are at sort of the kind of basic level. I feel that as a healthcare system, we need to move towards incorporating these other variables, which are not there at the moment. Sometimes they are, but they're not fully incorporated into the healthcare system. And you need to be referred outside, or you need to seek outside, and you need to do a lot of homework on your own terms. I was quite motivated about that. So it was kind of easy for me because I was very frustrated. I didn't want to be in the situation I was, and I was looking outside for those solutions. So I sought them. But sometimes people are not so fortunate and they don't know where to look. And so they get trapped. And that's an obstacle towards their healing and to their recovery. And it's not only just medications. I think the mental health and those invisible strategies are very important as well, but they're not readily available. So I would say that, that's an area that definitely needs to be looked at. And I think there are great organizations such as who are working on those areas. So it's all very positive.
Absolutely. And, you mentioned that you found yourself kind of seeking wellness strategies by yourself with your own agency. But, do you think that this goes to show that there's a need for healthcare systems where maybe resourcing is an issue, or because we can't just blame the healthcare providers because they are overburdened. So do you think that patient organizations have opportunities there to complement the healthcare system to cover the gaps in social and emotional well-being and aftercare that perhaps the health system is missing?
Very much so. I mean, there's been extensive research around these gaps, the socio-economical gaps and gender gaps, and it's been researched extensively and documented that they are very strong indicators on a patient having a positive recovery towards their health. But yes, you are correct in saying that we have a very good health system, but there are some it is disjointed. It is coming together. For example, I find that sometimes my data doesn't connect across different hospitals and GPs and so forth. So it's important that that is looked at. I mean, we have great technology at the moment. We have a lot of great minds out there, but somehow it's not being utilized effectively and efficiently in some of our healthcare systems. I'm sure people are looking into that. But yes, I think that there are always gaps, but they shouldn't be seen as a hindrance towards any patient having a successful recovery journey. I think those need to be managed, and I think we do need to have open communications with organizations outside of the healthcare system and bring them in. It is a team effort. I mean, I come from a time, this is going back X amount of years when even mental health wasn't even discussed, and now I'm in an environment, thankfully, as part of my own health journey, that I can discuss my mental health, and it is accepted. It's not frowned upon. But there was a time when those things were not discussed. So we have moved, we have taken giant leaps, but I still think there's a lot of work to be done. Absolutely.
Thank you. You articulated some of the nuances there really, really well, both from a patient perspective, but also some of the nuances that we as patient organizations representing patients feel frustration around. Just really quickly before we open it up to a larger panel discussion, briefly, would you weigh in on kind of the effects it maybe had on some of your friendships and maintaining a social life in a sense, with your new boundaries and kind of new barriers to socializing?
Yes, it had a very big impact. For me, especially, I had lost all my mobility. I was in a wheelchair. I couldn't walk. There was a time I couldn't even feed myself. So I had a major loss of identity. In my mind, I still saw myself as my former version, but in the physical world that I currently was in, she just did not exist. Now, that had a major impact on my mental health, that I couldn't even start to socialize, even if I wanted to, because I had no connection with myself. I had lost the self. And, you know, I can't even recall how I got through that period at that time. I was lucky. I had a very supportive system around me. People around me were also going through their own mental issues. For example, my husband was very supportive, but now that I look back, he had his own mental health issues because he was dealing with me, and he had his own fears and anxiety. So I think at that time, you're not really looking at socializing, you're just looking at surviving. And that is your social environment, is trying to find a road back to yourself so you can socialize. Now, I am a lot more sociable, but it's different because it's changed my personality. For me now, even the small wins is a major day for me, you know, whereas before, maybe I didn't practice that gratitude as much. And now just going out for a 10-minute walk, it, you know, is the best thing in my life. And that to me is my social aspect to the day, you know, and then from there, the hope is to actually grow that. But I can't tell what my days are going to be like.
Yes. Well, yeah, you brought up a great point as well of the role of carers in this and their social and emotional well-being as well. I'm going to bring in our other panelists again, so Lisa and Bia, for kind of a wider discussion where we can dig into a couple of these topics again. So, Lisa, would you mind offering some of your insights into the role? I know you mentioned some of your programming, but the role that patient organizations can play in filling the gaps in the health systems that fail to address the social and emotional recovery holistically. I know Kulvinder touched on some of that, but maybe you have some thoughts as head of programs in GRI.
Yeah, thanks, Aisling, and it's so fantastic to hear about your experience. Thank you for sharing, Kulvinder. I suppose thinking about the emotional and social side of things, the mental health side of things as core to well-being, as core to recovery and prevention in you know the kind of wider sense. I really think that we should be looking for mental health care to be integrated within the health system and within the work of patient organizations. It's not an either or, and I think the ESC consensus statement can play a role in helping us to see opportunities for integrating mental health care within cardiac care. I think that's what we should be aiming for, and I think as we move towards more integrated care, far better understanding of things like patient-centered care, I think we're actually in the best position we've ever been to ensure that we understand what mental health care within cardiac care and stroke care means, what different people need. We're not talking about one-to-one counselling in all cases necessarily. Mental health care is way more than that. For example, the full implementation of cardiac rehabilitation is an example of a psychosocial intervention, because we're getting at all of the aspects of people's well-being needs, the physical, the social, the emotional, in terms of information and routine. All of these things play a role. And then in terms of the role of patient organizations, in the big picture, I particularly think we have a role to play in the longer term. Kulvinder really described that early experience so well. You're surviving. There are so many phases to recovery, and in a lot of cases, the initial support and services offered by the health system addresses many of the things that need to be addressed. Obviously, there's always more work to be done, but what we often find is over the longer term, say 6 months or a year or 18 months after someone has been discharged, people have gotten busy again. Life has started to take on whatever form it's taken. People might be working, they might have caring responsibilities, and also naturally we can move away from our healthier routines and focus with time. That's very natural. So we often find people calling our helpline or popping into our building here in Galway with questions. They're feeling as though they've gotten busy again and they're worried. I feel like I'm not watching, what I eat as much as I was, or I'm out of my physical activity routine, or, I'm feeling like I'm being pulled in 100 directions again, that kind of thing. And I think we have a really important role to play, to be always there for people to touch base for information, for emotional support, for peer support, because all of those things make up our well-being. And for example, we're running a program at the moment called Healthy Hearts Club. It's part of the JCARDI, European Joint Action for Cardiovascular Disease and Diabetes. And that's looking at that longer term support for people after cardiac rehabilitation. So I think there are loads of opportunities, Aisling, from that perspective, as well as the advocacy, the sharing of experiences, the getting involved in raising the voices of people affected by heart conditions and stroke, to keep improving things and supporting each other.
Amazing. Thank you for that insight, Lisa. Perhaps, Bea, I'm going to jump to you, just conscious that I know Peter had felt passionate about this and had probably planned on talking about it a little bit. But do you think, certainly for cardiovascular disease as a whole, but particularly for the social and emotional challenges that come with stroke, do you think there's a stigma for men, particularly around expressing their emotions and a general awareness around the effects of a stroke beyond the physical sense?
Yeah, thank you for asking that, Aisling. This is actually a very recurrent conversation that we have during the My Stroke. This is one of our Life After Stroke programs that we have here at CRI. It's mainly an educational program where we cover information about what happened to your body, to your brain after the stroke. And emotions are always a very recurrent topic, especially when it came to the emotion that men are feeling after their stroke. In general, we could say that women, we tend to be a bit better in sharing and talking with others how we are feeling and what we are going through. This is obviously a generalization, but men tend to be a little bit more inward for this kind of conversation and then try to hide what they are feeling. So for someone who is 50 years old, 60 years old, they have had a stroke, and in the past, the life that they have before the stroke, they weren't an emotional person. I have had men here coming to my office and say, it's the first time that I cry in the last 25 years, 30 years. So having this conversation is very important, fairly, just to normalize this emotion and the change that people have to go through after the stroke. In my personal situation, I found very useful to explain to them the physiological changes that our brain have to go through after the stroke, and that help them to understand that it's not only that they are little bit more emotional because all the lifestyle change that came after an event like that. Is also the fact that your brain is going through physical change, and the part of your brain that are in charge of controlling behaviors, emotional problem solving, they may have been affected. So we need time to recover. We need time to accept and understand what we are going through. And in the same way, this is an analogy that I like to use because it's very visual, very easy to understand. In the same way that if someone break an ankle today, we are not that person expecting to go for a run the day after. We can expect that someone after their stroke have everything tight and managed. Things take time. There is a lot of things to accept, to understand, to rediscover about ourselves. So yeah, I think that having this conversation are very important, and they are actually, it's not that they are very important, they have to happen. It's very important that we acknowledge these chains, and that we can go talk about that, and that we as a professional create the safest space for our participant to come in and talk through and express how they are feeling.
Absolutely. And do you think it should be, just to follow on from this, Bia, I might stick with you if you don't mind. Do you think this should become part of best practice where not just men, but people who have survived a stroke or a major cardiovascular event should be signposted to support groups, storytelling groups, places where they can share their lived experience, and just hear that others are experiencing the same and that they're not alone?
Absolutely. My experience say that they can be very helpful. It's sometimes people experience a huge instant release just by listening other people experience and knowing that they are not alone. There is other people who are going through very similar situation, and there are professionals there that, like Lisa and myself, that we are here to help and support them regardless the effort that they may take. So yeah, they should be a core part of every intervention, especially for people that are living back in the community, as Kulvinders explained before very well, and when talking about her own experience. Sometimes we, as professionals, we need to find the right moment to deliver the message. Maybe when that person is learning or trying to survive is not the best moment to have this type of conversation. Maybe we need to allow them to take a bit of time, reflect in how they are feeling, understand the changes that are going through, and then have the conversation about mental health. So the conversation have to be there. The important point from my perspective will be to find the key professional to deliver this message and when the message need to be delivered.
Thank you, Bia. And Kulvinder, I might switch over to you now and just ask, do you think that there's a gap in our understanding of what cardiovascular disease actually looks like? Because obviously, you're a young woman, you've made a huge physical recovery and you're now dealing with that social and emotional aspect. And do you ever feel like people are looking at you and thinking, oh, well, she's fine, she looks fine, and that has an impact on you and your recovery and your ability to share how you feel?
Very much so. I think people look at me and I feel like a fake sometimes, because they say, well, you don't look ill. but I've heard that said so much now that I think that there are so many chronic ill communities where that seems to be signposted a lot. We have been conditioned to believe that illness looks a certain way, and that's not true, you know. So it's about going back to basics and re-educating ourselves about the physical appearance of what an illness looks like. And it varies because it varies person to person. You know, there are, you know, what Lisa talked about very early on in the webinar, that there are numerous invisible aspects to any illness. You know, those are the areas that we need to be looking into. And I personally find it a challenge. You know, if I'm looking well that day, whatever that means, I actually worry that if I'm going to an appointment, a health appointment, and I am not feeling well, but I look well, that I'm not going to be you know, listened to as well. So, you know, those kind of psychological, emotional anxiety that, oh my God, I should try to look unwell because then I will be listened to. You know, those things are not acceptable, really. But I think silence, patience, that those are some of the obstacles that we have to consider quietly in our minds.
And just very quickly, conscious we only have a couple of minutes left, as much as I would love to keep this conversation going, do you feel that need to kind of justify your feeling unwell, whether it be mental or physical, do you feel that comes as part of being a woman as well? That sense of dismissal.
Yes and no. I would like to say no. I think it's more of a patient's predicament overall. I am more worried about being classed as a difficult patient after I've asked questions about my protocol and wanted to understand about, you know, what else I can do to aid my recovery. And in doing so, I'm classed as a difficult patient. And I have been in those situations. And I think that is more of a concern for me. So no, I don't think it is a female issue as such. It is a patient predicament.
Well, that's, you know, that's really great insight into what, you know, these little nuances of that come with being a patient. Um, Listen, I would love to keep this going. This has been an incredible webinar. Thank you all to all of our panelists. I see the comments section, the chat box, and people have really enjoyed it. And thank you for sharing your story, Kulvinder. With only a minute left, I'd again just like to thank you all for joining this insightful session on what is often an overlooked topic. So I hope you've all gained at least one key takeaway from this topic. Huge thank you to our audience. Thank you to my Global Heart Hub colleagues who've helped me facilitate today in the background. You will receive a survey once I finish the webinar, and I hope you'll take the time to fill that out. It really helps guide us through generating new webinars. For anybody interested in learning more about Global Heart Hub or joining our community, don't hesitate to reach out to me. And thanks again, everyone. Have a lovely rest of your day.